about IBS and celiac disease? Maybe you feel better without eating gluten, but you're not sure if you've ever been tested for celiac disease or not. In this episode, I'm going to talk about the crossover between IBS and celiac disease, what's the problem with not knowing if you've got it or not, and also how to get tested so that you can be really sure that you've got irritable bowel syndrome and treat it accordingly rather than being confused about the role of gluten in your diet. Welcome to episode 73 of the Inside Knowledge podcast for people with IBS. I'm Anna Mapson. A lot of people I work with have already given up gluten by the time they come to see me. And sometimes they feel better at first when they've given up gluten, but the problems persist and come back and they're still not quite sure whether they should eat gluten or not. It is a topic with so much misinformation, especially on apps like Instagram, TikTok. You often see gluten being described as inflammatory, but just to let you know, it's not inflammatory. And I really get so mad seeing people describe food as toxic or inflammatory because no one food is going to raise your inflammation markers unless, in this case, you do have celiac disease. And that is why we're going to be really clear today about how to get tested for that and how you would know if you had it. So to go right back to the beginning, celiac disease is an autoimmune condition where your body reacts to gluten. You might want to listen to episode 16 that I did about a year ago, talking about should you go gluten-free if you have IBS. And in that episode, I break down a lot about the differences between gluten and wheat and fructans, and why you might be reacting to gluten products and why you might feel better without them in your diet. So go back and have a listen to that. It's a really good episode just explaining a bit about gluten. But essentially it is a protein in grains, whole grains like wheat and spelt. And people who have celiac disease have a reaction to the gluten that means that their gut cells almost like begin to attack themselves. So it's an autoimmune condition, as in other autoimmune conditions like type 1 diabetes, like lupus. These are all conditions where your body attacks itself, and that's why it's called autoimmune. And celiac disease is one of those. Because it is in the gut and the digestive symptoms are very similar to IBS, unfortunately, a lot of people who have celiac disease are misdiagnosed with IBS in their diagnosis journey. So in some studies, 1 in 4 people have previously been diagnosed with IBS and then they go on to actually have celiac disease. And in one study, I think about a quarter of the people in there had previously been given IBS advice. So they'd been told these are the things you should do, follow the FODMAP diet, manage your stress. And actually, whilst managing stress and, doing a bit of exercise, those are always good solutions for health. They're not going to help you if you've got celiac disease, or, they might help you, but they're not going to resolve your celiac disease. So this just shows how difficult it is to get a really good diagnosis. And I think there's some research saying it takes on average 13 years to get a diagnosis for celiac disease, which is why it's really important that you do not assume you've got IBS when you start getting terrible digestive issues. You actually focus on getting a diagnosis of IBS, and majority of the time that is through ruling out other conditions. I mean, you can see how people assume it's IBS first because around 1 in 10 people have IBS in the UK. So statistically, it's much more likely that someone would have IBS than they would have celiac disease, because that's probably about 1 in 100 or 1%. But actually, within the population of people who have IBS, the number could be much higher. So it could be up to 3% of people who have IBS who've got undiagnosed celiac disease. So there was one study where they took 105 patients with IBS and 12 of them were actually found to have celiac disease. And when they started on their gluten-free diet and were really strict about it, 11 of those 12 people felt completely better. So it just shows that those people could have gone through all the IBS hoops, doing the FODMAP diet, doing the Nerva app, taking some antimicrobials, taking probiotics, it's not going to help because celiac disease was their problem. The symptoms of celiac disease, though, are very similar to IBS. So you might get bloating, abdominal pain, gas, diarrhea, and because gluten is in so many different foods, you could be getting a low level exposure without really noticing it as well. And this is partly the problem where people who have IBS and they give up gluten and they think, oh, I've cut out most wheat products, but I do like to have, I don't know, dry roasted peanuts or gravy that has gluten in it. You know, these kind of things can be a low level exposure that if you've never had it ruled out, could be upsetting your digestion and you're never going to get to the bottom of it. The difference between those symptoms in people who have IBS and people who've got celiac disease is that in IBS, it's not damaging your gut. It's not giving you lasting problems because, yes, it's uncomfortable. You're getting the pain, gas, bloating, fast transit time, all of those things. However, when people have celiac disease and they are exposed to gluten, those symptoms are partly down to the permanent or long-lasting damage that is happening to the small villi inside the small intestine. The villi are like tiny fingers that stick out into the tube of the small intestine. So they coming inwards into the middle of the tube and sticking out, and that is how we absorb our nutrients. They're a bit like, if you imagine a toweling robe or, you know, like a shower mat that you might have, a fluffy mat to soak up the shower drips when you come out of the shower. That fluffy mat has got lots of little fingers that stick upwards, and each of those fingers is covered in fluffy bits sticking out sideways. So you've got some coming up, some coming out, and that is what these little villi are like. It's a huge surface area, and that's how we absorb a lot of our nutrients. But when there's damage to these small villi through the gluten, what happens is these villi get shorter, and so you may end up with nutrient insufficiency or even deficiency over time because there's a lack of available space in order to digest the certain nutrients that we need. And it is a tiny amount of gluten that can actually do this damage. So if you imagine you had a huge box with 1 million red marbles in it, then only 20 of those million were blue. It's a tiny proportion, but this is the size of the portion of gluten that can have an impact on the gut of people who've got celiac disease. Just 20 parts per million. And that can over time lead to lasting damage and ongoing symptoms. So you're struggling with ongoing digestive pain, diarrhea, bleeding perhaps from your gut, excessive bloating and gas. To manage the symptoms of celiac disease, you have to be really strict and avoid it, so you don't even get that 20 parts per million. So if you live with other people who also eat gluten and there's gluten in your house, you have to be really strict. So that means you have to not share butter because their knife with crumbs on it could scrape against the butter, and then you take that butter and put it on your gluten-free bread, but you're still getting contamination from tiny amounts of celiac disease. You need to have separate spreads and jams. You need to have no crumbs in the house, like no crumbs in the kitchen. So for example, you'd need to ideally have a separate cupboard for all your food that people who are eating gluten need to be wiping down surfaces, like not letting it come into contact with any of your body. I worked with a client a little while ago who had celiac disease. She was managing it very well, but she often looked after some other children who came round after school and they would eat their snacks. And she realised over time that she was getting some symptoms from the crumbs that they were bringing into the house. Like, she was super sensitive to very small amounts. Just think like it's on your feet, then you might walk those crumbs upstairs, they might get in your bed, that you're just transferring small bits of gluten in your home. So ideally, you don't really want any in your house if you are positively diagnosed with celiac disease. Now, that level of keeping gluten-free is way more than most people who have IBS and tend to give up gluten are prepared to undergo. Maybe you have given up gluten, but there's no way you're that strict with it. You let gluten in the house, like you eat from the same butter as your partner. You're not sweeping out your kitchen drawers every few hours to make sure there's no crumbs. Like, these things are necessary, but only medically necessary if you have celiac disease. Most people don't need to go to that extent when they're gluten-free. The problem is that you can't diagnose celiac disease by looking at somebody or by guessing. You do need to have a blood test in the first instance, and that is looking for antibodies to the gluten in your blood. And then it might be followed up by a biopsy as well. There's also another way that you can get an indication if you might have celiac disease, which I'll come on to in just a minute. Because the blood test, though, is looking for antibodies, you only produce these antibodies when you eat gluten if you have celiac disease. So if you've got well-managed celiac disease and you're someone who's had it for years, you shouldn't have high levels of antibodies in your blood. And people who don't have celiac disease do not have these antibodies at high levels in their blood. So this is why it's a really good test. You know, the doctor can just take a small amount of blood and test and know whether you have got a reaction to the gluten. But unfortunately, a lot of people already give up gluten before they go for the test. And the problem is with a lot of people that I work with is that you've already given up gluten and you're quite loath to bring it back in again. For example, someone I worked with recently gave up gluten, felt a lot better when they did, and they hadn't had a test yet for celiac disease. So they had no idea whether they actually had celiac disease or not, but they were not keen to go and get tested again because they didn't want to get the symptoms back that they'd had. So one of the things I do talk through with my clients is about the difference between gluten, wheat allergies, and fructan intolerance. Fructan is a type of carbohydrate, it's a type of fibre basically in whole grains. And that is much more commonly the thing that with IBS you do react to. Sometimes it's about your portion sizing of how much wheat you're eating. And other people I've helped bring gluten back into their diet once we knew they didn't have celiac disease. I talked to them about how you don't have to go back to eating it 3 times a day. You don't have to have cereal for breakfast, sandwich for lunch, pasta for dinner, 3 big carb heavy, wheat heavy meals. Just because you don't have celiac disease doesn't mean that you should eat that much wheat. The way I've helped 2 clients in the last year go to get this gluten test, because they were in that situation that they didn't know whether they had celiac disease or not and were really keen to know, because I kept stressing if you do have celiac disease you have to be that strict that I mentioned, keeping your kitchens clean, excluding gluten from your home, etc. And until you know that, there's no way you can just assume that it's only IBS, because if you're reacting to foods like bread and pasta, who knows what it is you're reacting to. So the way I helped them to do that was through the FODMAP diet. So taking out all the fermentable fibres, allowing their digestion to calm down, reintroducing a few other things so we can get the diet a bit broader and a bit more back to normal, and then trialling reintroduction of wheat containing foods. Now luckily with both of these people they managed to get on okay with that, and they had to then eat gluten for 6 weeks in the run up to their test with their doctor. So the NICE guidelines in the UK state that a doctor should only diagnose IBS once they've ruled out other conditions, one of which includes celiac disease, because the symptoms are so similar. So it's a bit of an issue if you don't go to your doctor, but also if you're not eating gluten in the run up to that test. So like I said, you have to eat a little bit of gluten every single day, and it might be 2 Weetabix or maybe 2 pieces of bread like a sandwich, or some pasta. So something containing gluten every single day for 6 weeks. I mean, if you miss one day, it's not going to ruin everything, but it's just giving your body the best chance to make those antibodies that will show up in the blood test so that your doctor can make a diagnosis. If you are not in that position that I just described with my previous 2 clients that I had helped to bring the gluten back in, get to a point where you can reintroduce wheat containing foods, then see if you can keep it going for 6 weeks. But if you're nowhere near that, something else I've also done with a couple of people is to do a DNA test for the genes for celiac disease. So I don't subscribe to any genetic testing for my clients. I don't feel like there's enough evidence that for people I work with IBS, that knowing your genetic profile will help you in any way. However, this is one exception. So what you can do is get a swab test of the inside of your mouth, just gets your DNA, and then you post that off and they look at whether your genes contain the single nucleotide polymorphism, it's called, or a SNP to be the shorthand. And it looks for some particular genes that only people with celiac disease can have. If you have these genes, it doesn't mean that you've got celiac disease. That's really important to stress. All it means is that you have a predisposition to potentially have celiac disease. So one of the people I worked with, who I mentioned, went through this process, had a family member who also had celiac disease, a half sibling. And so that was really important to rule it out, because they were more likely to have it because they shared some DNA with somebody who also had celiac disease. So an important question for you might be, has anyone in your family got celiac disease? That will help give you a little nod to whether it might be worth going through this process. But the problem is that actually 40% of the UK might carry these genes and they don't have celiac disease. So knowing you've got the genes doesn't really mean anything other than if you don't have the genes, it can rule it out for you. So if you don't have the genetic predisposition to get celiac disease, then you won't have it. But if you do have one or two of the genes, then there is potential for you to develop celiac disease, but it doesn't mean that you will get it. So importantly, what I also wanted to round up this episode with is saying you can have celiac disease and IBS. And so unfortunately, some people don't feel better even when they have really well managed celiac disease. You might have IBS as well, or maybe you have small intestine bacterial overgrowth as well. Around 30% of people with celiac disease continue to get symptoms even after they've managed it really well. Now, if that's you, one of the things you might want to do is to look at whether you have got any other health conditions. So keep going back to your doctor to check if you've still got symptoms, because there's something called refractory celiac disease where you're still getting the damage and the ongoing issues even though your exposure to gluten might be well controlled. This is where it can really help to work with a specialist nutrition professional, someone your doctor may recommend you to, who can assess your diet and ask lots of questions about your home just to make sure that you really know what you're doing when you're managing celiac disease and not inadvertently exposing yourself to any. Other research just shows as well that between 11 and 18% of people who have celiac disease also have SIBO, that's the small intestine bacterial overgrowth. So they're much more likely to have a microbial overgrowth in the small intestine if you have celiac disease, and that might be down to disruption or, depending on the damage that was there, depending on lots of other things like your diet, all the same causes of SIBO may be applicable. It's also good to think about overall optimizing your diet, even when you have a gluten-free diet. Doesn't necessarily mean it's a good healthy diet. I know somebody who really struggled with constipation as a result of a very low fibre diet from being gluten-free. So they were super strict about not having any gluten, really well managed, but were really struggling with constipation. And as soon as they were able to increase their fibre intake from whole foods, then they could really see the benefit and really start reducing some of those symptoms, because actually whole grains are a really important part of fibre in our culture, in our diet. And so if you're taking that out, you're going to lose a lot of fibre. Now, luckily, a lot of gluten-free products are starting to really focus on fibre and adding it in foods such as ground lentils, maybe inulin. The problem is that they are not great for some people with IBS. So again, where you have IBS issues as well as celiac disease, you may find that some gluten-free products are actually triggering gas and bloating, even though they are gluten-free. If you're struggling with IBS and celiac disease, then please do get in touch and ask me about setting up a call where we can talk about what help you need with your diet and digestion so that we can get you feeling back to full health and feeling better again. If you like to investigate working with me, I run a 3-month gut reset where I work with people on a one-to-one basis over 3 months, giving you everything you need to turn your digestion around to reduce bloating, stop the uncomfortable and unpredictable symptoms of IBS. If that sounds like what you need, then please do get in touch via a link in the show notes or just send me an email, also in the show notes. Thanks for listening to this episode of The Inside Knowledge. Better digestion for everyone.